I want to tell you about a patient of mine. She was 77 years old, widowed, living alone. She had survived a hip fracture 2 years earlier and spent 3 months in rehabilitation afterward. When she came to see me, she moved carefully, the way people move when they've been frightened by their own body. When she sat down across from me, the first thing she said was, "I think I'm just getting to the age where I need to accept what I can't do anymore." I hear some version of that sentence more than almost any other in my practice, and every time I hear it, I think about the research sitting in my mind that says the exact opposite. I'm Dr. Eleanor Hayes, an internal medicine physician, and in over 20 years of clinical practice, I have watched one specific type of exercise transform the lives of patients in their late 70s and 80s in ways that no medication I have ever prescribed has replicated. Not dramatically, not overnight, but steadily, measurably, and profoundly. That exercise is strength training. And before you change the channel, before the image of a gym full of young people lifting heavy weights makes this feel irrelevant to your life, I need you to stay with me for the next few minutes. Because what I'm about to describe has nothing to do with that image, and everything to do with whether you are still living independently, still thinking clearly, still moving through your own life on your own terms at 80, 82, 85, and beyond. Here's the concept I want you to carry through everything in this video. I call it the muscle-life connection. After 75, muscle is not just about strength or appearance. Muscle is metabolically active tissue that regulates blood sugar, supports bone density, protects joints, produces anti-inflammatory signals, supports cognitive function, and is the single strongest physical predictor of independence in the final decades of life. Losing muscle, a process called sarcopenia that accelerates dramatically after 70, is not an inevitable consequence of aging that we must passively accept. It is a condition that research shows can be meaningfully slowed, stopped, and in many cases partially reversed through one specific intervention: strength training. Let me tell you exactly why, and then let me tell you exactly how, in a form that is safe, accessible, and genuinely transformative for someone over 75. Why muscle loss after 75 is more dangerous than most people realize. Most people think of muscle loss as an aesthetic issue, something that makes them look frailer, something that makes physical tasks harder. Both of those things are true, but they are the least important parts of the story. Here is what the research actually shows about sarcopenia after 75. Muscle tissue is the body's primary site of glucose uptake after meals. When muscle mass declines, the body's ability to clear glucose from the bloodstream declines with it, directly contributing to the blood sugar dysregulation that drives type 2 diabetes and metabolic syndrome. Research shows that people with greater muscle mass have significantly better insulin sensitivity and blood sugar control than those with less muscle, independent of body weight. Muscle tissue produces signaling molecules called myokines when it contracts during exercise. These myokines travel through the bloodstream and have documented anti-inflammatory effects on the brain, the cardiovascular system, and metabolic tissue throughout the body. One myokine in particular, called irisin, has been studied for its potential neuroprotective effects, with research suggesting it may support brain health and cognitive function. Muscle, in other words, is not passive tissue. It is an active endocrine organ that communicates with virtually every other system in the body, and it only produces these beneficial signals when it is being used and challenged. Muscle loss directly accelerates bone loss. Bone density responds to the mechanical loading placed on it by muscle contractions. When muscles pull on bone during exercise, it stimulates bone-building cells called osteoblasts. As muscle mass and strength decline after 75, the mechanical stimulus for bone remodeling declines with it. This is one of the primary reasons why sarcopenia and osteoporosis so frequently occur together, and why falls in people with both conditions are so catastrophically dangerous. And falls themselves are where the muscle-life connection becomes most urgent and most personal. Research is unambiguous on this point. Muscle strength, particularly in the legs, hips, and core, is the single most important modifiable factor in fall prevention after 75. Not balance exercises alone, not walking alone. Strength. The ability of the muscles surrounding the hip, knee, and ankle to respond rapidly and powerfully to an unexpected shift in balance is what prevents a stumble from becoming a fall, and a fall from becoming a fracture, and a fracture from becoming the event that ends independent living. The patient I described at the beginning of this video, the woman who survived a hip fracture and came to me ready to accept limitation, had lost significant muscle mass during her recovery. The fracture itself was less dangerous than the muscle loss that followed it, and both were preventable with the right intervention, applied consistently over time. What strength training actually means over 75, and why it looks nothing like what you imagine. Here's what most doctors don't take enough time to explain. Strength training for someone over 75 does not mean a gym membership. It does not mean barbells or weight machines or anything that requires equipment you don't own or a facility you'd feel uncomfortable entering. It does not mean pushing to exhaustion or training through pain or doing anything that feels unsafe or beyond your current capacity. Strength training, in its most accessible and research-supported form for adults over 75, means applying progressive resistance to the major muscle groups of the body: legs, hips, back, core, and arms, in a controlled, deliberate way that challenges the muscle slightly beyond its current comfort level and then allows it to recover and adapt. That challenge can come from body weight alone. From a simple resistance band that costs less than $10, from a chair, a wall, a kitchen counter, and your own living room floor. The equipment is almost irrelevant. The principle, progressive overload applied safely and consistently, is everything. Let me describe what this actually looks like in practice for someone who is starting from very little. The one exercise that changes everything, and why researchers keep returning to it. Of all the strength training movements studied in adults over 75, one emerges from the research with remarkable consistency as the most impactful, most functional, and most directly connected to the outcomes that matter most at this age. It is the sit to stand. I know that sounds almost insultingly simple. Stay with me because the research behind this movement is extraordinary, and understanding why it works so powerfully changes how you think about it. The sit to stand exercise, rising from a chair without using your hands, lowering back down with control, and repeating, is the most direct functional training for the exact muscles and movement patterns that determine whether you can live independently. It trains the quadriceps, the large muscles at the front of the thigh that are the primary drivers of standing, walking, and stair climbing, and that are among the first muscles to decline dramatically after 75. It trains the gluteal muscles, the powerful hip muscles critical for stability, fall prevention, and the ability to rise from the floor if a fall does occur. It trains the core in its functional role of stabilizing the spine during movement, and it trains the coordination between all of these muscle groups in the precise pattern the body uses dozens of times every single day. Research published in journals of gerontology and physical medicine has shown that the ability to perform the sit-to-stand movement, measured by how many times a person can rise from a chair in 30 seconds, is one of the strongest single predictors of functional independence, fall risk, hospitalization risk, and even mortality in adults over 75. It is not a peripheral fitness test. It is a direct measurement of the muscle-life connection in action. And here is the most important finding. Research consistently shows that adults well into their 80s can improve their sit-to-stand performance, their leg strength, their balance, and their functional independence through a few weeks of consistent strength training. The muscle, even at 80, still responds to challenge. The biology of muscle adaptation does not stop working at 75 or 80 or 85. It slows. It requires more recovery time, but it does not stop. The woman I described at the beginning of this video started with a modified version of the sit-to-stand, rising from a raised surface with her hands available for safety, focusing on the controlled lowering phase first, which builds strength with less balance demand. Within 6 weeks, she was performing 10 sit-to-stands from a standard chair height without using her hands. Within 3 months, her balance scores had improved measurably. Within 6 months, she told me something I wrote down because I wanted to remember it. She said, "I stopped moving like someone who is afraid of falling. I don't know exactly when it changed, but it changed." That is the muscle-life connection made visible. How to begin, safely, progressively, and without fear. Here is the practical framework I give to patients over 75 who are starting strength training for the first time or returning after a long absence. Start where you actually are, not where you think you should be. If rising from a standard chair height is difficult or feels unsafe, begin from a higher surface, a firm bed, a raised toilet seat, a chair with additional cushioning that brings the seat height up. The movement pattern is identical. The muscle training effect is real. Safety always precedes progression. Focus on the lowering phase first. The eccentric phase of the sit-to-stand, the slow, controlled lowering back into the chair, builds significant muscle strength, and is inherently safer than the rising phase because your body weight is being decelerated rather than lifted. Lowering slowly, taking 3 to 5 full seconds to return to the seat, is genuinely effective strength training even before the rising phase becomes fully independent. Progress gradually and consistently. Research on strength training in older adults consistently shows that 2 to 3 sessions per week, with 1 to 2 days of rest between sessions, produces meaningful strength gains while allowing adequate muscle recovery. Starting with one set of 8 to 10 repetitions and progressively adding repetitions, then sets, then challenge, either through lowering seat height, slowing the movement further, or adding light resistance, follows the same progressive overload principle that underlies all effective strength training at any age. Never train through sharp or joint pain. Muscle fatigue and mild muscle soreness in the days following a session are normal and expected signs of adaptation. Sharp pain in a joint during a movement is a signal to stop, modify, and discuss with your physician or a physical therapist. Consider working with a physical therapist initially. Even 2 or 3 sessions with a physical therapist who specializes in older adult exercise can provide movement assessment, safe starting point guidance, and a personalized progression plan that makes independent home training significantly safer and more effective. This is an investment in years of independent function, not an expense. The broader ripple effects, what the research shows happens beyond the muscle itself. Here is what I find most moving about the research on strength training in adults over 75, and what I wish every person in this age group could hear clearly stated. The benefits extend far beyond the muscles being trained. Research shows that regular strength training in adults over 75 is associated with measurable improvements in cognitive function, particularly executive function, processing speed, and memory. The myokine signals produced by contracting muscle reach the brain and support neuroplasticity. Some research suggests that strength training may be more protective against cognitive decline than aerobic exercise alone. Research shows meaningful improvements in mood, reduced rates of depression and anxiety, and significantly higher self-reported quality of life in older adults who engage in regular strength training compared to those who don't. The relationship between physical capability and psychological well-being after 75 is profound and bidirectional. Feeling physically capable produces a sense of agency and confidence that reaches every area of life. Research shows improvements in sleep quality, in blood sugar regulation, in blood pressure control, in bone density trajectory, and in the speed and reliability of balance responses that prevent falls. All of this from one category of exercise, 2 to 3 times per week, in your living room, with no equipment beyond a sturdy chair. Here is the surprising insight I saved for last. The research on strength training in adults over 75 includes people who had never exercised consistently in their lives before starting. It includes people in their mid-80s. It includes people who began in nursing facilities and rehabilitation settings. And across virtually all of these populations, the finding is the same. The muscle responds. The body adapts. Function improves. Falls decrease. Independence extends. It is genuinely never too late to begin. That is not motivational language. That is what the data shows. Here are 3 smart questions to bring to your next appointment. Would a referral to a physical therapist for a strength training assessment be appropriate for me given my current health and mobility? Are there any specific medical reasons I should modify or avoid certain strength training movements given my health history? Can we track my grip strength and sit-to-stand performance at future appointments as functional markers of my muscle health? Let me leave you with this. You are not at an age where the conversation about strength and function is over. You are at an age where that conversation is more important than it has ever been, and where the actions you take in the next 6 months can meaningfully shape the next 10 years. A chair, your own body weight, 2 or 3 times a week. That is the entry point to one of the most well-documented health interventions available to someone over 75. The woman I told you about at the beginning? She still comes to see me every year for her annual checkup. She is 81 now. She gardens. She babysits her grandchildren. She travels. And every time she sits down across from me, she sits down and stands back up without using her hands, without even thinking about it. She stopped accepting what she couldn't do, and she found out how much she still could. Now I want to hear from you. Have you tried strength training after 75? Does the idea feel intimidating or out of reach? Leave your question or experience in the comments. Each week I bring your real questions to specialist doctors, and yours could be featured in an upcoming video. Tell me what topic you want next. This channel exists because of you. If this video helped you or someone you love, please share it. And please subscribe. Every week I share research-backed health insights you won't find in a 10-minute doctor's visit. This video is for educational purposes only and does not replace advice from your personal physician.